Well, if you're suffering from a chronic condition like irritable bowel syndrome, are there other disorders that you might notice, but you might not know what the source of those disorders are? You might need to go and talk to a doctor because there might be something that you're doing and you're consuming that might be having this impact on you and you might not even know it.
Yep, and thank goodness Dr. Sebastian Castelli, owner of Functional Health Solutions, is here. He's going to break down how to handle these health problems that actually hit really close to home for you. This is something that your son Gio had been going through, and you had to figure out, you had already been dealing with it with your patients, but now you had to deal with it with your son.
Yeah, talk about his story.
Right, so I've got two boys, Donovan and Gio. Hi guys. But Gio, this is when he was like, 18 months, like a year and a half. He had chronic ear infections. There's the little guy. And he started also getting this really severe rash on his behind. And so, we thought it was maybe just diaper rash or fungal. And so we tried topicals, we tried all different, nothing was working.
The rash was not going away?
It was not going away. And so, because we thought maybe originally from antibiotics, he was getting a fungal problem, but it would not go away. And so finally, I decided, all right, the whole family's going to do what I make my patients do. I figured I'm going to walk the walk here. And we did a very strict elimination diet. So, and simultaneously, I took some blood work on all of us, and it takes about 3 weeks to get the results back. So I started this diet. We took out dairy, gluten, soy, eggs, peanut butter, nightshades. I mean, you name it, we took it out. So you could imagine the tension in that household.
Sure.
Like the first couple
all of a sudden
nights.
You were taking away probably most of the things that he was used to eating.
Kids eat, mac and cheese, kids eat pizza. So it was tough, and I came home a few nights where, like, literally my wife is in tears because the kids refuse to eat, and she's like, they're going to starve, and I'm like, all right, just try to go a little longer, and she did, and she came up with some great recipes, and it wasn't even 2 weeks in, and his skin was completely normal.
So what was causing it? What was it that they were eating in that diet that you think was causing these problems?
Well, so for Gio, it definitely was gluten. That was one of them. Because like what we did was, after about 2 weeks, we provoked. We gave him a little piece of toast in the morning. By lunchtime, it started getting red again. So
really?
Yeah, and then the blood work confirmed gluten, dairy, so cheeses, that type of stuff.
Yeah. I went through a similar thing. I noticed that I went and did the topical thing. I went and got something from the dermatologist.
Yeah.
And it was like a rash I kept getting on my elbows. And it went away for a minute, and then it came right back. And I realized I cut sugar and I cut gluten. It went away. Just those two simple things. I'd already cut dairy, so that wasn't a factor. But similar types of things. You talked about a blood test. This is very important because there's blood tests that you can take, probably we can get through you, that will break down everything, and we can see what our allergens are.
Yeah, that's important because there's celiac disease, okay, that's a severe autoimmune condition involved where you ingest gluten and there's a severe attack on your gut. So everyone associates gluten with celiac disease, but there's a lot more to it. And so instead of doing a celiac panel, which is what most people get tested for, I run a really comprehensive gluten sensitivity test. It's through a company called Cyrex Labs, and you can look them up online. They've got a lot of great information. And that test is a lot more sensitive. So we avoid the false negatives that we get when we only run that celiac panel. For example, that happened with my wife. We ran a traditional test, and then months later I ran the Cyrex test, and sure enough, she was positive on those while she was negative on the celiac panel.
Wow.
So.
Now, are you seeing a lot of patients then coming in with these same kinds of symptoms, and now you're able to kind of notice it a lot sooner?
You pick them up. It's almost standard. It's almost assumed that they're sensitive, and I don't have to. And we can do the testing to figure out, but it's so common to see. The studies show upwards of 30% of the population is sensitive to gluten. We don't even realize it.
What are some of the symptoms? I mean, obviously, if you have celiac disease, you're going to be feeling that. That's pretty intense.
Right.
But more moderate forms of an irritation, or
it could be like we talked about, like the skin, brain fog. I mean, it sounds kind of vague, but people are walking around in kind of a fog. It's vague inflammation, right? So we talked about skin irritations, nerve issues. So that's a big thing. Thank you. Now I remember. The thing is, gluten is often causing an attack on our immune system. I had a patient, a little girl, who she was having nerve pain in her leg, and it turns out it was certain foods that triggered that nerve pain. Think of like inflammation as a result of an autoimmune attack on the body. So this is why my kids don't touch it. Like, we're 4 or 5 years in now, no gluten, period, because I know of the effects that it has on the brain, on the nerves. I was literally at a conference, you know, learning this stuff at one of the conferences. I texted my wife and I was like, all right, no more gluten, period. Like, this is like 4 or 5 years ago.
You got it.
I was like, all right, I get it now. I see why that's so important.
So if we're feeling the congestion in the head and we have things, irritations and all these things that are going on and it doesn't seem to be going away.
Yeah.
How do we get a hold of you and what do we do? You have a special offer right now?
Yeah, so today, again, we're going to do first 25 callers who qualify, free consultation. Have patience with Jessica on the phone. She'll get you scheduled. And this is just a great opportunity for us to talk. It's no pressure, but lets me know but what's going on. And I'll tell you realistically if I think this is something that we can address and help.
Go get the blood test to see if indeed you have this
Intolerance.
Intolerance,
Yeah.
sensitivity,
Allergy.
I'm just
whichever.
going to go limited just to see what happens. You made me think. Okay, thanks so much. We appreciate you being here. And thanks so much to Functional Health Solutions for coming on and sponsoring this segment.
For more information, and to schedule an appointment, just ask for Dr. Castelli, or you can go to drcastelli.com or call him at 904-503-2119.